This is Sarnia Lambton Daily for Monday, May 11th. Good evening, I'm Terry Doyle. Sarnia's only long-term care facility in coronavirus outbreak right now saw a third death of a resident over the weekend and an increase in positive cases. The total number of residents of Vision Nursing Home that have tested positive for COVID-19 is up to 8, with 2 staff members also testing positive. 3 of the 8 residents to test positive have passed away. The outbreak there was originally declared on April 23rd. Looking at the overall numbers for the region, 200 people have now tested positive for the virus, with 17 deaths and 142 people considered recovered. That leaves 41 currently active cases in Sarnia Lambton. 8 of those confirmed cases are in hospital. Blue Water Health has been reporting a steady decline in the number of hospitalized cases, but today's number is an increase from 7 over the past few days, the first increase of any kind in about 2 weeks. Meantime, the local medical officer of health is reminding people to maintain physical distancing measures, even with people they know. Much of the spread of the virus locally has come through close contact with other positive cases.
About 60% of the cases that we're finding now are either close contacts of known cases or related to an ongoing outbreak. And that's very important because it helps to suggest that the primary driver of transmission is close contact or contact in a setting where there's potentially a human vector, such as in a care setting where you're having care delivered from person to person. That's very important. It helps to confirm kinds of things that we already believe about the virus. That's not to say that there may not be some other transmission drivers, but this one seems to be the primary one right now.
In other news tonight, Sarnia City Council met virtually today to take care of some business. Late fees and interest for Sarnia property taxes are now being waived through the end of June. Council had previously approved pushing the April payment back until the end of May. Councillors considered the idea of gradually re-implementing some service fees, such as transit fares, but any decision on that was put off until the June 1st meeting. Councillor Margaret Bird suggested fees for certain services, such as transit and arena fees, be increased when the services go back to full-time use to make up for lost revenue. Let's check in with Myles Vanni over at the Inn of the Good Shepherd. As we know, it's been very busy times there. And Myles, right off the bat, how are we doing there?
Well, thanks, Terry. Thanks for having me back on the show. Things are starting to get into a routine. We're starting to see the support that's come in from the community, from our food banking network, enabling us to get a lot of resources out, a lot of food out to folks. One of the things we're very grateful for is through Feed Ontario and Food Banks Canada, we've started to receive emergency food hampers. We've been building our own kind of boxes of food supplies. These hampers are now coming in, which certainly saves us a lot of resources, a lot of time in trying to source the food. And now we're able to get those out to folks. And we've been a little worried because the number of families that we're helping has dropped a bit. We're not seeing the normal number of families. Started to realize that with schools not in, these kids are at home. It's much more difficult for families to be able to get to the food bank to get that food package that they need. So we're really pleased. We're partnering with other community groups like the Circles program, YMCA, Children's Aid Society, so that we can provide them with the food boxes and their workers are delivering them to make sure that those families are being looked at. So there's been a tremendous community kind of let's work together and make sure that nobody falls between the cracks. Just
to clarify a couple of things you said there. First of all, the hampers. So if I'm picturing this, it is now a case where almost pre-assembled, I'll call it. Is that what happens? Is that what is happening? Where almost pre-assembled kits are coming in to easily go back out?
Absolutely. As soon as this happened, because our normal food hamper is people come in and it's like a little grocery store and they can have the dignity of choosing the food items they want. But we had to, of course, because of social distancing and the need to flatten the curve, we had to go to a pre-pack. So we've been building our own little boxes with stuff in them. And so this shipment coming in from Feed Ontario and with the help of Food Banks Canada is really helping to kind of take some of the pressure off us, trying to source some of the food and build the boxes.
And I guess on the other side, the other part you touched on there, I guess it's a whole new distribution network, because indeed that does make sense where parents can't necessarily run out and do those errands because they've got the kids at home. And I guess, as you said, you probably had to exactly find those new distribution networks to get the food out to people.
Exactly. And working with other agencies like Canadian Mental Health, they're getting food hampers out to clients. Also with Lambton Elderly Outreach and the Red Cross, they're fantastic helping to deliver some of the hampers out to folks that are shut in and that can't get out to us.
You talked about getting into a routine a little bit more, as we all have over these last 8 weeks or so. But in general, and not asking you to quote numbers right now, but in general, what are you seeing in terms of the need now compared to the need 3 months ago, for example?
If we look at kind of pre-COVID, certainly the numbers coming in the morning to the food bank during those hours are less. But when you add in all the hampers and the boxes that we're now distributing and delivering, those numbers have gone up. Same with the meals. The number that are coming in for the meal to take that takeout container home, those numbers are less showing up at our door. But we have so many more people in shelter now that we're feeding them rather than coming here. We're feeding them in the shelter or in the areas where we've got them safe. So we're seeing those numbers up. And of course, as I said, with the shelters, pre-COVID, we had about 30 people in shelter. We now have, it was 65 people last night in our care in the lodge. We've had to kind of thin the numbers out at the lodge for distancing, but we now have people up in motels, in an apartment floor. We have the Sunbridge area that we use for overflow and our isolation site. So we've seen a pretty dramatic increase in the number of people in our shelter care.
And I guess I remember talking to representatives from the county recently and elderly outreach as well, and everyone just sort of working together. And I guess that's been a new thing as well, is the shelter program, where before it was indeed at the lodge, for example, but because of distancing and needing to spread people out, that's a whole new area.
The shelter was never built with 6 feet of space between beds and that sort of thing. So yeah, with the support of the county, and they've been great helping and coaching us and providing resources as we go along, we were able to get people out and into the motels and into these apartments and the Sunbridge, so that we have that distance, and we just really trying to protect people. Those that are homeless are pretty vulnerable. Their health already is compromised, so we're trying to protect them as best as we can.
Have you found that at least with some of the government programs rolling out, because we know there is a delay sometimes between announcements and then money in hand, have you found indeed with them sort of rolling out a little bit more, that has helped some people out?
Yes, it's been able to reassure us that we can get people into motels, because the big question is we got to get them out of the lodge, but how do we pay for these motels? And through the funding announced by the province and the county flowing that through for us, it's taken some while for those dollars to flow through, of course. But the county was very quick at saying, do what you need to do, and we will deal with the cost of motels as that funding comes in. So it's been a really good process that way. And something quite remarkable, I think sometimes we as a community take for granted for some of the things that we do on a regular basis. And I've shared with some of our other executive directors, we have a pretty close network of executive directors of agencies. We meet every month just on a normal basis, see what trends are, where needs are, how we can help each other. And so when this COVID thing hit, we were, I think, way steps ahead of a lot of other municipalities, because we have that cohesion. We've got that sense of we're already working together and we know each other. And a lot of communities, as I talk to other food banks or shelters, they don't have that same kind of connection with who's who in their community. So when we have a situation come up, I can pick up the phone and talk to the ED at Children's Aid or at Rebound or Lambton Elderly Outreach, and at the health centers, and everybody's been quick to respond and help each other out. So I think we've been really lucky with the way our community is so close knit, that it has really helped us to have a quicker, more coordinated response to help people.
And I've got to think, versus I'm sure if you've heard from people in other municipalities, it's that red tape where there might be access to certain assistance or certain ways of working together, but they had to break down some of those barriers that you don't have.
Exactly. And even just knowing who to pick up the phone and call makes a big difference. If you have to spend some time trying to figure out what agency does what and where can I get help. But because we've got that network already well established here, it's been a lot easier process for us to do problem solving because we know who to pick up the phone and talk to.
Myles, how nice is it when you see things like there was that concert on the Sunday night a few weeks ago that went national through Food Banks Canada and all the major networks, where it's that obviously it's the financial donations, but just that moral support as well.
You know, I can't understate how important that moral support is. It's been really tough for our team, trying to reinvent everything and repurpose how we do things, and making sure we don't miss people. And then we've also gone through a struggle here where we lost a very close team member of ours who passed away suddenly last week. And the response to the community for the last 6 weeks, and when they're making donations, they can make little comments online. And it is so uplifting and so heartening for our team to know that we've got the support of the community that allows us to kind of dig a little deeper and put in those few extra hours or try to figure out the problem solving. And that it's that community support that has really pushed us through, whether it's those kind words or whether it's volunteers coming in to say, hey, I can help build some boxes or distribute the food or sort it out. That's what's keeping us going.
No, it's great to hear, Myles, and I've got to think as part of that is making sure some of the existing programs are running as much as possible because of this increased need. I'm thinking, for example, a well-documented and very successful income tax program that is something that maybe isn't top of mind to people, but for the people who need it, it is very top of mind right now.
Absolutely, and that's why we've made the income tax program one of our priority programs. Others we've been able to kind of set aside, but particularly for this one, getting people their income taxes, their refund, making sure their child tax benefit continues, their GST benefits continue. Those are critical incomes for a lot of the households and families we serve. So being able to make sure that money is still flowing, that it's not interrupted, is really important because it also gives people a sense of being a little more self-reliant. We know that 40% of the people using the income tax program, that's the only program of the IN that they use. That's the only reason they reach out to us, which gives them that dignity of being able to be self-sufficient all the rest of the time. And so with the United Way support for this program, and we were thrilled that they renewed that venture grant for another year for us, that allows us to help all those people be independent and not so reliant on the community.
I guess that's the thing. For example, if you don't file your income tax, any child tax credits or anything like that, that you can't get unless you do that.
Exactly. A senior on a guaranteed income supplement, if they don't file their taxes, then that gets cut off in July, and they're left with a really vital gap in their income. So by us being able to keep this program going, and we've got a team of volunteers that are still working hard at filing taxes for us, then that's really going to help these people.
Myles, give you the floor for a second here. What would you say to the community, and what can the community watching us right now do to help at this point?
Well, we just are so grateful for the community of keeping us in mind. And the generosity has been great in helping us to make sure we've got food supplies and we're operating. The challenge is that we will get through this, but it's really hard to estimate what it's going to look like when things open up again. A lot of fundraising events, are going to be very different if they even happen at all. And those fundraising events keep agencies like ourselves going. And so there's going to be a lot of ourselves and a lot of agencies that aren't sure what it's going to look like in the summer and the fall, as people have been very generous now, but they also have struggles themselves. And will that carry through to the fall? So there are going to be pretty uncertain times. We're a little worried about what will happen once the moratorium on evictions and shut-off notices is lifted. Will that see a lot of people who are behind or further behind in their hydro or gas about to be shut off, about to be evicted? we're a little worried that we're going to see large numbers starting to come in July saying, now we need help just keeping the roof on our head.
Well, fingers crossed that things continue to move in the right direction. And Myles, as we always say, keep up the great work yourself, the staff there, the very dedicated team of staff and volunteers who work together, and we'll catch up to you again soon.
Well, we certainly appreciate the community and RTV, the donation that you're able to secure for us, and the work that you and your team do to help get the word out and keep everybody connected in this time of social distancing. Thank you for that important work.
We're all working in this together. Myles, all the best.
Thank you.
There's Myles Vanni, the Inn of the Good Shepherd, joining us here. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, we certainly know there are many people having a difficult time getting through this pandemic, whether it's the stress of health, financial, many other things certainly impacting their mental health. But what do you do if you want to help someone who is struggling? We get more in this report.
Hey everyone, it's Justin the therapist again. So great to be back here. And today I want to talk to you about something that I get a lot, a question that I get a lot, which is a lot of people come up to me and say, you know, Justin, I'm not really struggling with my mental health, but I have a friend or a loved one, a family member that's struggling with their mental health. How do I help them? What should I do? So this is how you help someone who's struggling with their mental health. I want you to imagine that you are walking with your friend, and then all of a sudden your friend falls into a pit, like a 15-foot pit, and they're just there. What do you do? So obviously you'd probably panic and go into survival mode where you're just trying to like save them, right? So you'd go, you'd run, you'd try and get some help. Maybe you'd go and get like a ladder or a rope or whatever you can do, whatever it takes to save your friend who fell into this pit. And I think what we do is when we notice that someone is struggling with their mental health, we do the same thing. We look for the ladder for anxiety, the rope for depression, just trying to get someone out of this pit of despair and sadness and fear. But here is the thing. That doesn't work. There is no ladder or rope for anxiety or depression. There is no easy way to just pull someone out. So it doesn't work. We tend to think of maybe you can give them some advice. Maybe we can just tell them to think about things in a different way, and that will help them. So we tell them, you know, you need to just kind of adjust the way you're viewing the world. You need to see it this way. Or maybe we'll tell them that, you know what, you just need to do this thing. You just need to go and talk to this person, or you need to go and behave this way or do this. That also doesn't work. And what's worse is sometimes we will get into the sense of like, not only are we telling them you need to do this to get better, but the fact that you haven't done so already is because you're weak. Like the fact that you're struggling with your mental health, that's a matter of mental toughness. You just need to be tougher. You just need to like see things in a different way. Or, you know, other people have it worse than you. You should be thankful. You should count your blessings. That really doesn't work. In fact, that's often harmful. That makes it worse. That's like your friend falls into a pit, and instead of trying to help them out, you're telling them, you know what? The fact that you're in the pit and you haven't climbed out is because you're too weak. And if I were in the pit, I would be strong enough. I'd be able to climb myself out. So you need to be tougher to get yourself out of the pit. That does not work. Why don't those things work? Well, here's the thing. Often people who are struggling with their mental health, they will feel like they have tried all of the different ropes and ladders to get themselves out, and they feel stuck. So you coming in and maybe offering some sort of advice or new perspective, it may frustrate them because they feel like, I've already thought about that. I've already tried that. It's not working. So this is what you can do instead. So your friend is in a pit. What I invite you to do is actually get in the pit with them. Sounds crazy, right? But here's why it works. When someone is in a pit, when someone is in a mental health pit, Mental health issues have the tendency to make us feel like something is wrong with us, that we're abnormal. We're not like everyone else that's happy and easygoing and whatever. And because we feel different when we're struggling with our mental health, it makes us feel isolated and alone. And that sense of disconnection from others actually makes the mental health issues worse. So when someone is struggling with their mental health, and either your friend or your loved one, the best thing you can do for them is join them in the pit. Temporarily, not forever, of course, because you have to take care of yourself, but figuratively and literally sit with them in their sadness, in their anxiety. Sit with them. And think of it kind of like when someone is sick in the hospital, not with an infectious disease, not with coronavirus or something like that, but maybe something that isn't infectious. Maybe someone is sick with like cancer. If someone is struggling with cancer, does that mean that you shouldn't visit them in the hospital? No, you absolutely should. Does that mean that if you visit them in the hospital, their cancer is going to be healed? Probably not, but it will certainly help. And I think that's the same thing with their mental health. If you can sit with someone, be present with them, you may not, solve their mental health issues, but that's not the point. That's not your role in this. Your role is to support them, be there for them, make them feel like they're not alone. You'd be surprised at how much that can actually help them feel a little bit better. The second key thing to do when you're sitting with them is to ask them how they want to be supported. I beg you, if someone is struggling with their mental health, please ask them, what would be helpful for you? What do you need right now? By you just asking them, you are opening them up to them asking for their needs, which can make a tremendous difference. They may say something like, you know what? I just want to feel heard. I just want to feel validated. And you can hear them. You can sit, yeah, wow, that's really tough. I don't know what I would do. Wow, yeah, if I were in your shoes, I'd be struggling too. I don't know how you're handling it. That in itself can make a tremendous difference because it helps someone struggling feel like they're not alone, like they're not crazy for struggling with these things. Maybe they don't want to talk about their mental health issues. Maybe it wouldn't be helpful for you to pry and ask for details about the things that are bothering them and why it's bothering them. So in that case, don't. Just, maybe they want something else. Maybe they're looking for someone to come and distract them, watch something funny with them. Maybe they're looking for, just they want to hear about your life. Maybe hearing about your life would be something to get their mind off their own issues that they feel stuck with. And that can be helpful too. But make sure that's what they want. You don't want to be going and talking about your problems in your life if that's not what they want. Maybe they are actually looking for advice. And in that case, gently offer some advice. But remember and invite them to remember that you are not a trained mental health professional. You can't be a therapist for them. The key is you want to remember that you are there for them and you give them the option to share with you what they need. And you gently provide it while remembering that you are not their therapist and reminding them you're not a therapist. Of course, if they're open to it, and if you feel like it's safe to recommend, then offer to go and see a therapist. And here's the thing. Let's say, for example, things are really, really bad and you're worried about your friend and they're in a huge crisis and they need immediate professional support and they can't wait for, a therapy session. Here is what you can do. Go to ementalhealth.ca and then click on Crisis and Emergency. It's a Canadian website that provides a list of mental health resources, and if you click on Crisis and Emergency, a list of crisis and emergency distress lines and services in your area. You can filter by area.
Stay tuned. You are watching Sarnia Lambton Daily on your TV. That's going to do it for our show tonight. Thank you very much for joining us. For all of us here at Your TV, I'm Terry Doyle. Have a good evening. We'll see you back here tomorrow.